Well, Americans are dealing with a surge of heart disease, diabetes, and other serious illnesses. While we usually think of our nutrition or prescription drugs as a prevention, you should also be thinking about your dental care. Dr. Sean Moriarty here to explain why not taking care of your teeth could actually lead to some of these serious problems. Good morning. Thank you for joining us this morning.
Thank you. It's good to be here.
A lot of people don't link your mouth with your heart and diabetes. What are the link there?
So diabetes and heart disease, and there's a lot of other systemic diseases which are actually linked to your mouth and linked to poor oral health and periodontitis. For those of you that don't know what it is, periodontitis is an infection in the gum and bone of the around the teeth that basically is caused by bacteria, and these bacteria found in plaque that normally accumulate around the teeth get infiltrated in and around the roots and cause this infection. When this happens, basically the gums can bleed easily and these bacteria are allowed to enter the bloodstream, and this can cause serious problems. People that actually have severe periodontitis, it can be compared to having a 9 by 9 inch open wound in your mouth, and it allows large amounts of bacteria to enter the bloodstream, which can cause other problems throughout the body. What happens is these bacteria cause inflammation in the blood vessels around the body, and plaques can form and develop. And if these plaques break off, if they're allowed to infiltrate into the blood vessels that surround the heart, they can cause a heart attack. If they're allowed to go into the bloodstream and the brain, they can cause a stroke. In turn, diabetes is an inflammatory disease, which means it decreases the body's ability to fight off infection. If you have a decreased ability to fight the infection, type 2 diabetics can actually be twice as likely to have the periodontal disease, and also poorly controlled diabetics, who have larger amounts of blood glucose, cause the periodontal disease, and the bacteria that cause the periodontal disease to thrive in the mouth.
So what do people notice as far as symptoms? What would they notice with the periodontitis?
So with periodontal disease, basically symptoms are red and swollen gums, gums that bleed easily when brushing or flossing, dry mouth, also bad breath or a fruity odor on the breath, which can be indicative of diabetes.
So if you have some of those symptoms, what do you recommend people do, A, to not get to that point, and B, also to treat it if you do have those symptoms?
Yeah, if you have those symptoms, if you know you're predisposed for periodontal disease or you have it, it's extremely important that you go to the dentist on a regular basis. Usually twice a year is recommended for normal cases. And if you do have periodontal disease, usually it's good to sit down with your dentist and create some sort of a custom plan where you go at least 3 to 4 times a year, depending on that. Brushing twice a day, flossing once a day, and also using adjunctive agents like a Listerine or Crest Pro Health Rinse, things that have anti-gingivitis and antibacterial properties, is extremely important.
All right, so certainly some good tips here. Thank you, Doctor, for joining us this morning.